Hi, this is Lisa Broyles with Way to Health MD, and this video is part of my perimenopause series, but this video is for men, or for those that have a man in their life struggling with midlife hormone changes. So men do experience a slow decline in testosterone production typically. This is not true 100% of the time, but it is very much tied to lifestyle. So a man's body will make less testosterone if he is overweight because fat cells make estrogen, which directly antagonizes testosterone production. So the fastest way to get really low testosterone levels is to be obese, okay? So you need to watch your body weight. The more you exercise, that boosts testosterone production. So your body will actually make more of its own testosterone when you lift weights. And it's not how heavy the weight is, it's how many reps you do. So I've spoken about this in a few other videos, but to increase testosterone production naturally, there's a few tricks. And one of them is many reps, but lightweight. So say you're going to do 10 bicep curls, do a weight that's reasonable, that isn't going to strain or injure you. And well, when you get to that last 10, do just a few more. And that little extra push in reps, the number of reps, drives up testosterone production. So another thing is pomegranates, and pomegranate juice increases testosterone production naturally. So the most important thing that you can do to get your testosterone levels up or keep them up is to watch your weight and do weight-bearing exercise. So typically men's testosterone levels ideally should be in the 500 to 700 range when you get your blood work checked. Most men that I check, their levels are 300, sometimes even less. So if this is the case for you and you've already tried losing weight, or you're at your ideal body weight and your testosterone levels are still really low, then you're going to experience symptoms such as low libido, possibly some erectile dysfunction. You're going to feel tired. You're not going to have the muscle mass. You may even notice muscle wasting. So testosterone does all those for you. It increases libido, it increases your desire to exercise, and it improves your ability to put on muscle mass. So testosterone does a lot of good things for us. Now, too much testosterone can cause hair loss, it can cause acne, and it can cause irritability and anger issues. So there is such a thing as too much, which is not a good thing, but we want to be just right with that testosterone. I do use testosterone for women as well. Does the same thing for women, increases libido, increases desired exercise, ability to keep muscle mass. So it's very important for women, especially female athletes, to keep a healthy testosterone level. But this video is specifically designed for men. Your doctor can prescribe bioidentical testosterone therapy. I do not recommend the testosterone injections that are covered by insurance that you're given typically every 2 to 3 weeks at your primary care office. Yes, this testosterone is the cheapest form. It's testosterone cypionate. And yes, it's covered by most insurances if your testosterone levels are low on your blood work. However, this form of testosterone does have a slightly increased risk of increasing prostate size, so prostatic hypertrophy, which can inhibit your ability to fully empty your bladder, increase nocturnal urination. This form of testosterone also could potentially increase your risk of heart disease and stroke. So I do think that the best form of testosterone is a bioidentical testosterone that is made by a compounding pharmacy in the form of a cream applied topically or a troche that you dissolve under your tongue. Okay, it doesn't do well orally, so you really need to do the troche or a cream. Typically the cream is preferable, but the bioidentical testosterone does not show increased risk of any kind of heart disease, and in fact might actually reduce your risk of heart disease. Now, any form of testosterone therapy can increase the thickness of the blood, can increase prostate size, so I do monitor my patients' PSA levels yearly and their CBC or blood counts annually when they are on hormone therapy. Thank you.